Dysmenorrhea can feature different kinds of pain, including sharp, throbbing, dull, nauseating, burning, or shooting pain. Although the pains usually subside as menstruation tapers off, it may coexist with excessive heavy blood loss, known as menorrhagia. There are two types of dysmenorrhea: primary and secondary dysmenorrhea.
The major symptom of dysmenorrhea is lower abdominal pain, but associated with that pain, you could have some people being nauseated. Some people actually go on and vomit. Some may even start to pass frequent stools. Some may complain of headache. Some may be dizzy. Some may feel excessive fatigue. Some may even faint as a result of the pain. So there's so many other associated symptoms with that primary abdominal pain. Seeing menarche at 12 years, for primary dysmenorrhea, you expect that person will have been having that pain right from the beginning, first experience of menstrual period. Okay, you can avoid secondary dysmenorrhea by avoiding the onset of conditions that underlie secondary dysmenorrhea, especially the ones that are preventable. Okay, like the pelvic infection. You can prevent yourself from having a pelvic infection by maintaining good hygiene, avoiding unprotected sex, abstaining from sex totally, and if you must have sex, you should make sure that it is protected, so that way you can avoid a pelvic infection. Secondly, some people that make use of contraceptive devices that we call IUCDs, that these are contraceptive devices that are put into the uterus to prevent a woman from getting pregnant. So you might want to, if you have such a device, you might want to make sure that it's changed on the due date. It shouldn't stay longer than before. And if you have such a device, you mustn't have multiple sexual partners, and you mustn't be engaged in unprotected sex because you're at increased risk of having an infection. So basically, those are the major things that you can do to prevent secondary dysmenorrhea. On the other hand, let me just quickly talk about primary dysmenorrhea. Usually, the pain, like I said before, the pain can start before the period, or it may just start on the day the period starts itself. So what we advise a lot of people to do, especially when you know your gynae history and you know about how your body functions, some people may even start to use analgesics and anti-inflammatories before their periods to prevent them from having pains. But generally the treatment, I don't know if you are going to ask me that question about the treatment, but generally the treatment is use of anti-inflammatory drugs, and anti-inflammatory drugs like diclofenac, ibuprofen, Feldene or Cofelvin, even paracetamol can be used, and as well as drugs that reduce spasms, antispasmodics like Buscopan. Pain from your monthly menstrual cycle it arises from contraction of your uterus. Your womb contracts and cuts off blood supply to the inner lining of your uterus, and then that inner lining of your uterus becomes necrotic. That's medical language, but in layman terms, it dies. So when it dies, it now starts to shed off, and that process of dying, it now releases some more chemicals that are very, very sensitive to the nerves that transmit that sensation of pain. So that is like the pathogenesis of how pain comes about with dysmenorrhea. The pain of labor is similar in a way, but there are so many other reasons or so many other causes of pain in labor. First, the uterus is contracting very much in labor to try and expel the fetus. And secondly, the bones of the woman, they are expanding The bones are expanding, the ligaments are stretching, everything is stretching so that the baby can pass through. That can be painful. And even when the baby is passing through, the baby is pressing on certain sensitive structures, that can be painful as well. So you not having dysmenorrhea does not mean you would have more labor pain. It really does not.
Okay. Okay, as a young girl, and you're going through your monthly cycles and you've never experienced pain before, it's a very normal thing.
Yes, it is normal.
Okay.
It is normal for people never to have dysmenorrhea.
Okay.
Yeah.
Most times, to find the causes of dysmenorrhea, a healthcare provider will review one's medical history, including one's symptoms and menstrual cycles. She will do a pelvic exam. An ultrasound exam may be done. In some cases, the healthcare provider will do a laparoscopy. This is a type that enables the examination to be done inside the pelvic region. Dysmenorrhea is mostly common amongst female youths as they are examined and treated differently by the girls. We went to the streets to hear the views of the public.
I'm Akigwala Folake. I don't really experience pain during my menstrual period. It's always very light. And there are times I don't even have any pain throughout. So it may be a bit difficult for me to really understand what it means to go through pain during menstrual period. I think that's just my experience.
Okay, menstrual pain, yes, I do experience menstrual pain. And I usually do use paracetamol or Panadol Extra, which I noticed that helps to subside the pain. It's actually a self-medication. I grew up asking my aunties, my sisters, and that was what they told me, and that's what I started using as well, but no doctor prescribed that to me.
I don't usually have pain during my menstruation, but I know people that do. My mother does have serious menstrual pain, and she uses ibuprofen and Felvin to suppress the pain. And before she starts her menstruation, she normally has pimples all over her face, just to make her realize that she's going to see her menstruation anytime soon. Okay, her usage of ibuprofen and Felvin is not a doctor's prescription. She just decided to use it and she noticed it works for her and she continued using it. Thank you.